So next we have the discussion about the perioperative glycemic control with respect to type 1 diabetes. So a 34-year-old man who is insulin dependent diabetic is undergoing an elective left hemicolectomy. What is the most appropriate perioperative management? So normal saline with intramuscular insulin, insulin infusion in normal saline only, IV dextrose with insulin and potassium adjusted against the glucose and potassium levels, continuous normal subcutaneous insulin, or none of the above. So, for our scenario, which is a type 1 established diabetic currently on insulin, our best treatment protocol will be giving the patient IV dextrose along with insulin and potassium, known as the GIK or the PIG regimen. Now, these levels are adjusted against the levels of glucose and potassium. So, type 1 diabetic who is insulin dependent undergoing a major surgery will require the glucose, insulin, potassium infusion. So, this is our principle in this scenario. This is also known as the PIG regimen, that is the potassium, insulin, or glucose. So, this regimen will maintain the blood glucose levels while providing substrate and preventing hypoglycemia or decay. The infusion is adjusted for the hourly capillary blood glucose levels, and the normal value for that is the 6 to 10 millimoles per liter, and for the potassium levels for which the value is 3.5 to 5.5 milli equivalents per liters. So you need to know these values for reference as well. Now, potassium levels are adjusted because insulin will drive the potassium into the cell. So, there is a risk of developing hypokalemia. So, you have to add potassium as well. Subcutaneous insulin is unreliable for such major procedure, and intramuscular insulin is also unpredictable. So, what we use is that we add 0.45% sodium chloride into 5% glucose, and we also add an amount of 0.3% potassium chloride. Now, this will make the ideal fluid which is used in the GIK infusion protocol. So, for a type 1 diabetic going for a major surgery, we give the patient glucose, insulin, potassium infusion. For that, this formula is very important to remember. Target blood glucose is 6 to 10 millimoles per liter. Monitoring the capillary blood glucose and potassium for hourly, because insulin will drive potassium into the cell, so there is a risk of developing hypokalemia. Subcutaneous insulin is unpredictable, and never omit insulin in type 1 patient because it will increase the risk of diabetic ketoacidosis even if the patient is fasting. So this concept is high yield